Chest tube insertion by clinical clerk Justin May A. Roma. Chest tube insertion is an essential skill for hospital doctors dealing with certain pleural diseases to drain the pleural space either with air, blood, chyle, pus, or other fluids. Indications include pneumothorax, hemothorax, pneumohemothorax, subcutaneous emphysema of the chest wall in a patient who has sustained chest wall trauma requiring ventilator support or general anesthesia, empyema. These are the materials to be used: surgical gloves, needle holder, surgical scissors, Kelly forceps, tissue forceps, scalpel, silk O with curved cutting needle, chest tube at least 28 French, syringe, local anesthetic, povidone iodine, vaselinized gauze, and plaster. Before starting the procedure, it is important to introduce yourself to the patient and obtain informed consent. Have the patient assume a semi-upright position with the arm placed above the head. Wrap the skin over a wide area of the chest wall with povidone iodine. At the 4th or 5th intercostal space, anterior axillary line, infiltrate the skin with a local anesthetic and block the intercostal nerve branches. Do not forget to infiltrate the pleura. Make a 2.5 to 3 cm long skin incision well into the subcutaneous tissue. Measure how far the chest tube is to be advanced after placement. The tip of the tube should be placed at the apex of the lung. Insert a curved Kelly clamp and cut or separate the tissues so as to create a tunnel or tract in the direction in which the tube is to be inserted. This tract should be directed posteriorly, cephalad, and medially. Continue developing this tract all the way into the pleura. Remove the clamp and explore the tract with a gloved finger from time to time to make sure the tract is going in the right direction. After the pleural cavity has been entered, insert the gloved finger to explore for adherent lung and then further enlarge the opening in the pleura by inserting a large Kelly clamp and spreading it. Select the tube to be used. Note the location of the holes and the distance of the proximal hole to the tip of the catheter. Grasp the tip of the tube with a long Kelly clamp so that the long axis of the clamp is almost parallel to the long axis of the tube. If hemothorax is suspected, it is also advisable to clamp the very distal end of the tube to avoid making a mess. Insert the tube into the chest using the large Kelly clamp as a guide. Remove the large Kelly clamp as soon as the tube reaches the desired position in the chest. Palpate to ensure that the tube has entered the chest. Suture the chest tube to the skin by placing a horizontal mattress. Connect the tube to the underwater sealed chest drainage system and remove the distal Kelly clamp. Place a vaselinized gauze around the entrance site and a sterile dressing on top. And obtain a post-tube insertion chest X-ray to check the position of the tube.